Welcome then to this 60-minute session introducing Health Business Elite as we look at supporting healthcare management using this database. So Health Business Elite features comprehensive journal content, including full text access to the Harvard Business Review, and it also includes journals related to healthcare administration and other non-clinical aspects of healthcare institution management. For those who have not met me before or attended one of my sessions, I'm Richard Crooks. I work for the EBSCO Customer Training Services team based in the northwest of England. So I currently manage a team of trainers who are supporting yourselves in the UK, those also in Ireland and in the Nordics, and also in the Middle East and Africa. So thanks for joining this session this morning. So in terms of the actual objectives for this webinar, I hope that by the end of this session, you'll be able to describe the content and coverage of Health Business Elite, or otherwise know where to find that information. You'll also be able to find full text articles using keyword as well as subject searches. And also you'll be able to manage your search results, whether you want to save, print or email. And also you'll be able to set up search alerts and journal alerts for key publications in Health Business Elite. And some of the functionality you'll see mirrors that of what you'd expect in CINAHL and Medline on EBSCOhost as well. And also you'll be able to find further help and support information on using the EBSCO's interface. So again, I'm sure many of you are familiar with Medline, CINAHL and EBSCOhost. So obviously this is another database that we provide with emphasis on non-clinical aspects of healthcare. So in terms of the content then, so you have access to over 600 full text journals and magazines detailing all aspects of healthcare administration and other non-clinical aspects of healthcare institution management. About 280 of those, by the way, are active full text, so you get the current issues, etc. And the subject coverage includes computer technology, facilities management, hospital administration, hospital management, human resources, insurance, marketing, and more. Okay, so again, we'll look at these as we go through this session. In terms of some of the key titles that are included, so these ones specifically, as you see there, are ongoing or active full text. There's no embargo for these titles. So in other words, for these journals and magazines, you have access to the full text content. So if you come to the latest issue, the full text will be available, whether it's in PDF, HTML format, or both formats. So you have the likes of the Academy Management Journal, Academy of Management Review, Academy of Management Perspectives, American Journal of Public Health, the key journal there as well. Others include Forbes, or also Harvard Business Review, which we'll look at later. So I mentioned that at the beginning. So a crucial journal there for senior managers. That's available full text. Again, no embargo, active full text. You have others like Healthcare Financial Management, Journal of Business Continuity and Emergency Planning, Journal of Business Ethics, again, active full text or ongoing full text, and others such as Journal of Communication Healthcare, Journal of Economic Issues, Journal of Management Information Systems. So some of these you may be familiar with. And also includes Modern Healthcare, a classic title. I remember that back in the day as a nurse education librarian, and also Nursing Economics as well. So again, these examples here, all active full text with no embargoes. You can get to the latest content. So for your senior managers, management team, where you're based, they will have access to the full text content for these publications. And it also includes PC World there, which may be of interest as well. Now, if you do want a comprehensive list of the titles that are indexed, then I would recommend going to the ebsco.com website and for the Health Business Elite page specifically, because within here, it will give you the spreadsheet or HTML page to view the title list for journals, subject coverage, and other materials as well. So Health Business Elite does include market line reports, so it provides company profiles. So we'll see some examples of that as we go through this session. So again, there's other content other than full text journals also included in this database. So again, I recommend consulting this page if you want more detailed information about the title list, journal, subject coverage, etc. So that's just a brief review really of the content coverage of this database. We'll now go to the live demonstration and run some searches and look at the functionality there and explore some of the online content. So again, any comments, questions, or feedback at this time, feel free to post that in the Teams chat. And again, if I need to unmute you, then I can do so if you just select the raised hand icon. So I'm going to share my desktop now with you. So let me do that now. And in a moment, you should see the advanced search page for Health Business Elite. As you might guess, this is quite the typical standard entry point for most NHS, HSC users. So those who work in healthcare, typically your users, your clinicians, management staff, etc., are going to be accessing the interface in this fashion. So you have the multiple rows there for searching. You have the search modes and expanders listed below as well to enhance your search experience. I won't go into all those features because we do cover them in other sessions. We are using the same platform, EBSCOhost, of course, as you would expect with CINAHL and Medline and other databases that you may subscribe to from EBSCO. To begin with, we'll run a basic search and explore some of these options. We are going to look at change management initially. So I'm going to type in change management here, okay? And you see the autocomplete feature, which basically prompts you to choose potential searches that other users are using. You don't have to, of course. We'll leave it as it is. What we'll also do, apply one of the expanders here. So we've got also search within the full text. So basically what that does is literally look for your keyword search terms as they appear in the full text document. So whether it's a PDF article or HTML article or both, it will look through the document itself, or if it's a book chapter, etc., explore the full text content there, in addition to searching the standard citation fields. Now, if you want to know how's it searching by default, then go to the online help on the top right of the toolbar. And then within this window, if you scroll down to the bottom left column, and then you'll see there's a database help for Health Business Elite just by my taskbar there on the left. If I click on that link, it'll take me to the database specific help page for Health Business Elite. And on this, as is the case with CINAHL Medline, you'll see the searchable fields link, hyperlink there. Click on that and it takes you to the searchable fields section. And within this section at the top of the screen, you can see the default fields for unqualified searches. So by default, when you run a keyword search without any field code assigned to it, you're going to search through the author fields, subject fields, all keywords, that is author supply keywords, all title information, and that includes the source title and all abstracts. So that is how it's searching without any additional qualifiers such as the expanders, which I mentioned just now. So it will search within those fields, and with also search within the full text articles, it will search further to include full text content as well, specifically. So search within the document. So if there's a HTML PDF article available, it will also search within that full text in addition to the aforementioned fields. So we're going to run it in this fashion. I've also got apply equivalent subjects on, by the way. That is typically on by default for those who work in NHS England and other organisations, possibly the HSC in Ireland as well. And what that does is expand the results to map change management to a particular concept. It may also be change management. That in turn will then pick up the index terms. So you can see here on the top left of this toolbar, we have the subjects, the thesaurus there. So that would take you to the thesaurus and you could browse that thesaurus. But basically what we're doing here, we're expanding our search to search within the full text content. In addition, it's going to bring up any content that is mapped to this term, as it were, or this term is mapped to various subject headings. Okay, so just to explain that briefly, we do have a help sheet on that, by the way, more information on that if you need that information. So I'm going to run the search as it is right now. And I'm going to scroll down further, and you'll see on the left-hand column, it has recorded the search we're running. Now, you'll see proximity search now. So proximity search is what we used to say was Boolean phrase searching. So the label's been changed because it really reflects the kind of search that we're running here. So for those who work in NHS England, when you run a keyword search, it is a proximity search. It's searching for the words that you enter them in the order they are entered and near each other, next to each other, right? So it may differ from organization to organization. That is something which is configured behind the scenes in EBSCO Admin, our administrative tool. So there was a change back in June from the original Boolean phrase search mode to now proximity, which is more accurate and probably a bit more clearer for users. That can be reversed, by the way, it can be changed, but I won't go into the customization today. Now we have these expanders applied here. You can see I've selected also search within the full text. Apply equivalent subjects is selected here. You can, of course, remove these if you want to refer it to a default search. Just change management as it is. We'll leave it as so for now. We are going to limit to full text content. So I'm going to select this one here, this option. And then I'm going to also change the publication date. So at the moment, we've got content published since 1945, which is probably a bit too far back for our liking and for our healthcare managers. So we're going to drag this across, or you can enter the year in the box provided, but we're going to stop at 2009, the last 15 years or so. Okay. Then we'll move on to source types. Now, as you can appreciate, Health Business Elite includes numerous types of publications. I mentioned some already. You've got magazines, you've got academic journals, you've got trade publications, reviews, etc. We want to focus on academic journal literature at this time. So we are going to select this option here and then bring back the results there. So at the moment, as you can see here, we start off with over 12,000, and you can see it's 12,971 references. We've now narrowed it down to just over 2,000. So these are academic journal articles which have been published since 2009. Okay, the last 15 years. We can scroll down further, and we may want to be more focused, particularly on territorial coverage for the UK, for example. And you can see the subject. We've got these subject headings here. These relate to the subjects as you see here, and you can see the likes of change management featured here. There may be others also, hospital emergency services, etc. So these are various subject headings that are assigned to each reference that is indexed in Health Business Elite. Now, we are going to go for country-specific subject, as it were. So to do that, click Show More, and we'll also sort these alphabetically. So at the moment, you can see the majority of references are indexed with leadership, organizational change, followed by change management itself. But you can see the United States is here. But if we sort them alphabetically, click Name, and then again, you'll see United Kingdom here. So there's 29 references here, and we're going to update. So we're just going to focus on those 29 references in relation to change management that relate specifically to the United Kingdom, and you can see them listed here. Okay, so you can see the references here. So this one on the UK healthcare workers' experience of major system change, and that was during the COVID-19 pandemic. Okay, so these are full text articles in relation to change management published since 2009 that relate to the UK specifically, using the subject heading there as the basis for that. And you can see in the subject fields, the Kingdom is mentioned here. Okay, so you can view the full abstract for this reference by hovering over the magnifying glass, if you like, there, and you can see it listed here. Okay, again, Kingdom is mentioned there specifically in relation to COVID-19. You can also, of course, change the page options and go to a detailed format, click up Apply, and you'll see each of the abstracts displayed where available. Okay, so some of these are quite lengthy, of course. So for viewing on screen, it's probably just as well to leave it on the standard setting, but so you can revert to that here, but you can hover over the magnifying glass to view the abstract. Okay, and if you, of course, want to go to the full text, you can, well, actually the detail record page, you can click on the link there. That will also bring up the abstract, so you can view it from this page. And on this page, you can also save to Google Drive or OneDrive if you prefer. There, it asks me to sign in here to do this. Okay, so I can set it to OneDrive. I can add it to the folder. So if I click Add to Folder, it will place it in the folder on the top right of the toolbar for future reference, at least for the duration of this session. If I want to save this beyond the session, I need to sign to my EBSCO account here. Okay. We also have the print option as well. If you wish to have a hard copy of this and also to choose the field format, you can do so. Again, it's a standard EBSCO's functionality, and then you can print accordingly, and then you'll get the window, and you can still save this as a PDF or just send it to your printer there for this reference, this citation. We also have other functionality, of course. The email option is there as well. And with the email option, notice it will send the PDF as a separate attachment when available. So this one has a PDF article, it's available full text. And you can see here, it gives you the size of the file as well. And you can enter your email address. Again, you can choose the citation format and send it here. So that's confirmation that it's been sent to my inbox. Save just allows you to save this as an HTML page. It would also allow you to save it as a PDF as well, so you can use that option if preferred. The Cite tool is also available here. So if you're looking to cite this either in Harvard or another format, it does give you the various examples here of citations, okay, for this article, Harvard there, of course. but there's also this disclaimer that we advise users to note that they should consult your resources for the exact formatting and punctuation guidelines. Okay, so these give you a standard citation format for each of those reference styles, but we do advise they consult yourselves as library staff, librarians, regarding the specific formatting for your trust in organization, etc. The export tool is available as well. So if you wish to export an RS or RIS format, if you're creating a bibliography or advising users to do the same, then you can see here, we've got direct export here in a RIS format for EndNotes, Reference Manager, Zotero, etc. If you use RefWorks, then that option is available as well. And other formats are also present. You can annotate records as well on the detail record page. You can add notes here. So you could just add a comment here. Okay, whatever it might be, and you can save that, and then you can print the list of notes ultimately, or if you want to review the notes later on post session, you can sign into store notes here, and they'll be stored into your MyEBSCO personal folder. And the final thing just to mention here again, and some of you would have seen this before in other sessions, we have the permalink here. Okay, that will provide the direct link to go to this page. So if you want to just forward a link in a Teams message, WhatsApp, chat, or whatever it might be via email, then you can just send this link. The user will then need to authenticate via Open Athens, typically for the NHS, or other means of authentication to get to this article. Okay, so that's the way you process it there. Okay, so just an example there. And then if you want to look at the PDF, just literally just go into that link, of course, and you can view the e-reader here. And you can see here, this is from the International Journal of Health Policy Management, and you see the article with the abstract, etc. So you can see the original article reproduced electronically there, and you can navigate using the sections there, the pages there, and also you can download or print from this window as well and use the other tools which I mentioned just now. And if you use the permalink icon here on the tools menu, it will direct users who receive this link and authenticate to this page specifically. Okay, so the other one rates the detail record page, this rates specifically to the PDF article. Now, of course, you can navigate within this specific article if you want to review other content as well. You've got other articles here that you can view and scroll through. So again, you can look at the same issue and see what other articles of interest there are, or you can view another issue. So if you want to go to 2024, the latest issues, then you can also view that as well. Okay. So again, you can look at that content. Okay, now you will see some cases where, of course, HTML full text is available. You can see here with this item from the Journal of Supply Chain Management, there is this HTML full text link. If you click on that link, it will take you to this page. So you would have seen this before, again, with CINAHL or Medline on EBSCOhost. If you have, especially if you have the higher-end versions like Medline Complete, Medline Ultimate, or CINAHL Complete, CINAHL Ultimate, then you have the options to translate this. Obviously, if you have colleagues, managers whose English is not their first language, they can choose to read it in their own language, as you see here, and they could translate that, and that's a Microsoft translation, by the way. Otherwise, you've got the options for the text-to-speech software. You can also listen to it in a choice of accents, Australian, UK, or English, or American. And then you can also view in text mode format. Okay. And you can expand that if you need to. And we also have other options, including the page mask feature, which highlights specific sections here. So these are designed to improve accessibility to content online. And we have the download MP3 option, so the Read Speaker web reader software, so you can agree and download the file and listen to the article. So for busy managers, they don't have time to sit there and read it. They may want to list it on the journey home. Whatever they're doing, multitasking, they can have this read to them. Okay, and you can also navigate with the various links there using the contents navigation. Okay, and as before, you will see we've got these options here for tools. So again, you can add this to the folder, save this item here. You could email this, and if this is the preferred format to email to a user, to a colleague, then you can untick PDF and just send the HTML full text if you prefer. The cite tool is there again, so knowing how to cite this HTML article in the preferred format, you can export it also here. and also create a note, and there's the permalink. So the permalink this time would direct users, whoever receives this, one of your healthcare managers, for example, to this particular page. Okay. So again, any comments, questions about any of this functionality? I know it's probably familiar with most of you because of other trainings you've attended, but just to reiterate some of those elements there that you have access to. And before we'll move on to another search now to explore some of the other features as well. And by the way, you can resort these references to the most relevant here as well. So that's the most recent one. Sometimes they're one in the same, but not always. Okay, this one's a bit older, but it's coming from the Academy of Management Journal. Full text is available. And notice there's some images here as well, by the way. So there are some images. There's an image quick view feature, which allows you to preview some of the images that are included within the article itself. So these could be of interest, etc. So table chart here as well, and you can view the higher resolution image here. So again, you can explore some of these images. Some of them are illustrations, some of those are photographs. There's information on citing and also the permission statement, which indicates that it would be okay to use these for personal non-commercial use, used in presentations for educational use consistent. And now that is the US Copyright Act, but in principle, you can use it in the same fashion. Of course, if you post anything to the web, for example, a presentation, then that would need to be removed, or you'd have to obtain permission from the publisher. Okay, so just to clarify that information, that permission statement is there for each of these images. Okay, so I'm going to clear my screen now. So I'm just going to delete these for now. Okay, and we'll just run another search here. So this time what I'm going to do is a combination of elements. So we're going to look at staff shortage or absenteeism in the UK. So to do that, and of course there are numerous ways to search and more advanced ways, but just showing some key ways at the moment which may be of interest to your healthcare management team, etc., where you are. So we can look for staff shortages here. Now I can also use truncation, which is the asterisk. Okay, so staff shortages, or specifically absenteeism, and I can do this. So I can add the asterisk in place of the C or the T, etc. So for absence, absences, absenteeism, etc. So I think I can search for this first row here, and then I'm going to add below United Kingdom. Okay, so explore the UK or Great Britain, okay, or England, or Scotland, or Wales. I know I can also add Northern Ireland here, but I can put double quotation marks for the exact phrase. Northern Ireland, okay. So just to make that accurate there. Again, I can apply other features here. For example, also search within the full text of articles here. So we can apply those there. So we'll run the search as it is. Okay. So combining the two using the Boolean and here. Notice you've got or not also here. And you can add up to 12 rows here, by the way. You can just keep clicking the plus sign until you reach the limit, which is 12 on the current interface here. And then we can click search here. So we've got quite a lot of references here, of course, as you might expect. And we can, of course, narrow it down further. We've got over 55,000. That's because I've selected the also search from the full text. Again, we've got the coverage from, in this case, from 1922. That probably refers to Health for Harvard Business Review. I know that's available full text since 1922. Again, that's probably far too back. You know, we don't go back 100 years or so. So again, we can drag this across. We go for maybe the last 10 years here, 2014. So just drag this across, and this number should come down considerably. So well, it's got 23,000, so about less than half now. And then, of course, we can look at source types, or we can go specifically for publications. So if we go to publications here, you'll see the various publications. If I click show more and I go back to hit count, which is the typical default sort, a lot of these are news items. But if you sort them alphabetically and scroll down, we can choose specifically publications which may have interest. So for example, we're looking at GP. Let's see how it's not there. Interesting. So you have Harvard Business Review here, by the way. So you can select that item and the digital articles also, and then you can scroll down further. Okay, and you'll find we've also got here, let's go down the way down here, Nursing Management UK as well. Okay, and you see Nursing Economics there as well, which I mentioned earlier. So click Update here, and we'll bring up references in relation to those publications. Okay, so you can see how the first one relates to Harvard Business Review and so on, etc. Okay, and we might find some others from, these are going to be more current ones essentially. But if we go to relevance here, sorry, the newest, that might be the same here. So yeah, Harvard Business Review. Yeah, so you see this one, Nursing Management UK from June 2024. Now you will notice here, while Harvard Business Review is available full text, and that's from 9/22 to the present with both formats, HTML, PDF. Nursing Management UK, as indexed within Harvard Business Elite, is not full text. Now I will add a caveat to that, because if you subscribe to CINAHL Ultimate, so that's the higher end version of the CINAHL database, Nursing Management UK is indexed there and is available full text. You think, well, what difference does that make? It can make a big difference, because if you subscribe to CINAHL Ultimate and you also have a subscription to Harvard Business Elite, through our smart linking feature, it means those full text links that appear in CINAHL Ultimate will be available within this database. So in other words, you would see a link to the PDF or HTML, depending on which one's available, for this article. So that's within Harvard Business Elite, because of smart linking, it will pull or transfer the links from CINAHL Ultimate to this database. So there is also a lot of advantage to having a full text database like CINAHL Ultimate, where it will then, transfer the links to a database like Harvard Business Elite, which still has full text content, as we've seen, but there may be some journals like this one which are not available full text within Harvard Business Elite. So again, just to clarify that, that's just using the smart link technology that we have at EBSCO that transfers full text links from one full text record in another EBSCO database to a non-full text record in this case, Harvard Business Elite. So I hope that's clear. Let me know if it's not, and I'll try and explain that better. But at the moment, you can see this record here. This is from Nursing Management UK. You have the bibliographic record, you have the abstract included here. And of course, you can process it in this fashion as we saw earlier, add to the folder, email, print, etc. Okay, so again, you're able to quickly, reduce the number of references you've, retrieved, as it were. And the search itself, of course, is recorded on the left-hand column. You can see the search string, the expanders that are applied, the publication date, January 2014 to the present, and also the 3 publications that we've selected as well. Because there are other options as well, publisher here. And of course, we're looking at the RCNI because they publish the Nursing Management UK. So if you wanted to home in on the RCNI content, you can just click that link, and you can see these are the Nursing Management UK references. Again, a lot of the RCNI content is available full text with no embargo within CINAHL Ultimate. So again, those links will be transferred via smart linking. Okay. Now, if we wanted to save these records, of course, we can go through the listing here. So we click on the add to folder icon there, or we can go to share, and we can save the page results, 21 records. And if we go to the folder view, you'll see them stored along with the 2 others that we saved earlier. So these references are now available. You can still view the detailed record page. You can access the full text here from where it's available. But if you want to process these, then you can select these. You can print them, or you can email this list to yourself or manager, colleague. So depending on the nature of your searching. And then you can include, where possible, HTML full text, PDFs as separate attachments, and also include your current search history, how you search for this information. And that will send your search as an attached file, a PDF file. Then there's a citation format. You can click Harvard here, and then you can send this. So those 21 references would go to my inbox. Okay. Now, if you want to, again, if you don't have time to review these content, or you're going to run a few more searches to add to this, and then send it to a senior manager, for example, then what you can do is just simply sign into my EBSCO here, your personal folder. Now, for those who work in NHS England, you do have EBSCO single sign-on, which means when you click the sign-in option for the folder, such as I would have done just now, it will automatically synchronize with your Open Athens account and create the folder for you. Now, at this stage, I would need to sign in. I would enter my username, password if I have that. Otherwise, I can, in my case, I'm going to sign in with Google at this stage, and I choose my account here, and I'm going to just go into it. So basically, use the appropriate method for signing in to your folder, and then you'll see now it says Richard's folder. These are stored beyond the session. Okay, so I've got those references there. It also includes references to other searches that I've got here. And if you want to save the search, of course, you need to be signed into my EBSCO folder as well. So if we go back to this page, and then you'll see the search history, what we've done so far. Now, at this stage, you'll see the search history is displayed in reverse chronological order format. So S4, S3, S2. If you want to resort that in the sequence you started from, then click search ID and hash above the set number. And then you can see now how we've approached this search. So if I want to save this search, there are two ways to do it, essentially. One, you can just print a copy of this. Okay, you can, and then right click, and if you print it, it allows you to print directly, or you can save it as a PDF, and of course you can change the layout, and also if you want it to be more colorful, where's the color page? See it now. Okay, anyway, you can play with that as you were, as needed, and okay, you can save that. Otherwise, you just print it. But you can also, of course, save the search online. So go to Save Search Alerts. If you've not signed in, it will prompt you to sign in any case. At this stage, you can also change the search. You can go in and edit this, by the way. So you can, make some other changes here. And then we can, if we're happy with that, then we can save this. So if we can put staff sorted is, and I'll put August. Okay, and I can save it permanently or for 24 hours. So if I'm going to come back to this within 24 hours, that's fine. Otherwise, I'll save it permanently here. And I get confirmation it's been modified, it's been saved. I click continue. I'm taken back to my saved searches folder, as you'll see in a moment. And these are listed by default in chronological order this time. So you can see this one's 5 years old now. So if I scroll down to the bottom of the page, you'll see, or go over the next page, you'll see my search here. Okay. Right at the bottom there somewhere. There it is. So I've now stored this beyond the session. I can retrieve this saved search, rerun it in the database. So if I come out of Health Business Elite, maybe have a break, go back into it, come into my save search folder, I can retrieve it and rerun it. And of course, I can still edit that here. Okay. So just again, any comments or questions at this time from anyone regarding any of the features we've seen? It would be good to know if that's still of interest to you, or whether there's something else I've not yet shown you. I will just mention search alerts and journal alerts now, but if there's any questions or comments, please feel free to, add it in the Teams chat, or otherwise select the raised hand icon. So in terms of the actual search alerts, if we go back to the results list page and say we've run the search, and maybe you want to inform your managers of the latest content in relation to this search, then what you can do, you can go back to the search history, go to Save Search Alerts, and this time choose the Alert Radio button. Again, it could be the same name search that you use. Okay. Choose the frequency. So in other words, this search will be run in the background, and it would send into the person's inbox the latest content found. So it could be on a daily basis, weekly, or bi-weekly, for example. Then you can restrict it to articles published within the last month, 2 months, 6 months, 1 year, or no limit. So you might go for, say, 2 months. And then you can run this for up to 1 year or a minimum of 1 month. I'll go 6 months in this case. Okay. You can choose how results are displayed, the format. So by default, it's the brief citation. you can include the abstract with details, or if they are looking to create bibliography, select Bibliographic Manager, and then you can add the email addresses. Now, the great thing about this is, for terms of data protection, confidentiality, you can add more than one address using a semicolon. So if I use my colleague, let's see, not this one. Okay, my colleague Sud here, I can add his details. So you can add multiple managers here who may be of interest to this in this topic. Maybe they're working together or maybe they're not. Hide address from recipients so that it'll be a kind of blind carbon copy, as it were, BCC. And then you can add the title. You got the alert notification here. So maybe you put Health Business Elite alert. Just modify that. And then the email from address. Now, this may not be a problem for you where you are, but epalerts@ebsco.com, it could be blocked by a spam filter. It could end up in the junk mail folder. So you may want to include your own email address or library address here before sending. And that means it should go through, as it should go through and reach the recipient. It also means you get the kudos latest information. So that's alert that you're setting up for a user. It's coming from the EBSCO's database, Health Business Elite. You will actually get the kudos because the email from address will be your local library service. Okay, you can choose between plain text HTML, and you can include the query and frequency if necessary, and then click save here. Once you do that, you get confirmation that the alert's been created. You can see the alert name, the database it's running on, the duration, and the actual search string. Okay, there is frequency is also confirmed, and there is also the feed URL if you need that, if you still use RSS. So click continue. If you want to modify that or delete that in the future, then go to your folder, go to search alerts on the left hand column, and you'll see here this is the search alert we just created, and you can see it's going to be run bi-weekly against Health Business Elite. The results are going to be in HTML format sent to my inbox, as well as my colleague Sud here. So if I don't want him to receive that information, just click edit alert here, and I can remove him from this list, and then I can save. Now, of course, if you do this on behalf of a user, they're going to receive these alerts. You are then responsible for maintaining this. So if they turn around and say, I no longer require this, then you can go in and delete this here. Okay. So again, be mindful of that. You are then responsible for managing that alert. Of course, you can instruct them, educate them how to do that themselves as well. The final thing I'll show you here regarding alerts is the publication or journal alert. Before we look at company profiles briefly in a moment as well. So if you want to be alerted to the latest content of a given publication, go to publications here. So if you typed in Harvard Business Review, this will take you to this page. You can see full text available from 1922 to the present, both in PDF and HTML. Click on Harvard Business Review. And then this takes you to the publication page. You have the option to search within this publication, by the way. You have the publisher URL also listed here. You can also browse issues from this page. So the latest volumes, etc. Again, these are available full text. These are active, ongoing full text with no embargo. And then you have to click the share button, and that will give you the email alert option, which, as with the save searches, as with the search alerts, require you to be signed into your personal MyEBSCO folder. And then you can, again, configure this accordingly. So once again, you've got the email from address. You can change this. And then you can add an email address here. You can hide address from recipients. You can choose the email format. You can email contents linked to table contents or linked to individual articles. You can be alerted on the full text only, which this journal is full text in any case. And then you've got the results format, and then you can save the alert here. Again, the alert will be saved in the folder. This time on the left-hand column, you have the journal alerts option, and you can see here when this was set up and who it's going to. So again, you can modify this if you want to open it up to other managers. So click edit alert, then you can add other names here. Okay, and notice the initial duration for the alert is 6 months. If you feel that's too long, then you can change it 1 month or 2 months. If you feel it needs to be extended longer, it can go up to 1 year. One thing I'll say about the alerts in both instances, that it will prompt you. So with the search alerts, when they're due to expire, it will prompt you to continue if you wish. Otherwise, it will stop sending alerts according to the original expiration date. Likewise, with the journal alerts as well, you could extend it longer. You may want to set it up for 1 year in the first instance, depending on the nature of who this is going to, essentially. Okay, so against where you would edit or manage these alerts. And if you want to delete it, then you would just go in and delete it here. So that's now deleted. So that's the publications. Just one more thing then before we move on to any training support materials that we can offer. There is the company profiles here. These are provided by MarketLine, Medtrack here, as you see here. And you can see some of these are UK specific, like this one here. So you can click through to the Medtrack report here. And then you can see the headquarters is given, etc. and so on. Okay, so you can do that. You've also got the option to download the PDF or print and then use the tools to save accordingly here, as we saw earlier. Okay, and then the option to email also is included as well, and then the folder as well, and the cite tool. So you can be, given the citation for this company profile here, as seen here. Okay, with Harvard or this one particularly. Okay. So you can also access those. You can, if you put in UK here, for example, do a shortcut here and match any words, click browse. You'll see got the UK reports here. So for example, you've got Sanofi UK here. So you can click through to that, or the Medtrack report here specifically, and you can see that here. Okay. So again, you can view that information at your own time. Can download those. So those are also available. And as we saw earlier, you'll find MarketLine reports appearing also in the result list as needed as well. Okay. So aside from the help menu, which I mentioned earlier and showed you earlier, if we scroll down, you also have the EBSCO Connect link there at the bottom of the page. And then you'll see here, we've got links to the tutorials. Now, there isn't a dedicated public-facing tutorial for Health Business Elite. However, because we're using the EBSCO's interface, we do have the generic tutorials here with features such as citing articles here, creating a personal user account, creating a journal alert, etc. These are all details. It's the same functionality that you'd find in CINAHL, Medline, and other EBSCO's databases. Okay, so these are available here as well. Okay, for those of you who are looking at a more in-depth look at EBSCOhost, maybe you're new to this platform and you want to explore it further, under the learning link here, you are taken to EBSCO Academy, which is our learning management system. And within this page, we have the e-learning path for EBSCOhost. So some of you would have seen this before in relation to CINAHL Medline again, but you'll see there's a generic EBSCOhost research databases e-learning path, which consists of a series of courses, quizzes, and documentation that you can review in your own time. So these are self-paced, complimentary courses, e-learning courses, and for these you do need to register. So you click register, and then it will provide you with a link to request an account here. Okay, and that means you have an EBSCO Connect account. Use the Find My Organization feature to find your institution, so you can add your details there and request access, and you can complete that, and that will then allow you to sign in here on this page, and then that will take you into these courses. So again, they're just available for those who are specifically new to EBSCOhost. They are designed and intended for library staff only, by the way, not for students, not for managers, etc. So there's more information on this site, on this portal as well. What I do now is going to jump back to the PowerPoint. So let me do that now. We've also gone through the live demonstration. And while I did show you EBSCO Connect, there is also the training resources portal, by the way. So that is based on our Stacks content management system, which basically means we're bringing together numerous tutorials, help sheets, upcoming events in relation to healthcare databases available through EBSCO that would be of interest to you. So this kind of groups those resources together in one place, including the training videos, training sessions, support information as well. So this can be found on nhsresources.stacksdiscovery.com. And for those who may not have seen it before, I will post the URL in the Teams chat once I found it here. So I'll put that URL in the Teams chat for you to bookmark or explore it further in your own time. Okay, so that does have links to our YouTube channel, where these sessions that we run are typically hosted post-session once they've been edited. as well. Okay, so we saw there's also other links there to NHS training for those who work in NHS England, EBSCO Academy, which we just touched on, EBSCO Connect, our support site, and promotional materials also are included. So EBSCO Connect can also be accessed through connect.ebsco.com directly or via the link within the interface which I just showed you. And that will give you links to tutorials and of course EBSCO Academy, which we briefly looked at, and that takes you to the following page where there are additional videos that you can browse. These are English speaking, by the way, and also the e-learning paths and also other training sessions that we run, which are typically hosted on Zoom. And finally, then we do have a dedicated tutorial on creating journal notes in Health Business Elite, one I created some time ago. It's still valid. I may need to review this, but that is also specifically related to this database, which we touched on today. I know it's quite a bit to cover in a relatively short space of time. We are well within time. But are there any comments, questions, or any feedback? Maybe you've used this database before. Anything you'd like to share? I know at least one of you indicated you'd like to raise awareness of this database more with your users. So I hope that you've been able to pick up some tips here, some helpful points here for that. But are there any questions or comments at this stage before we close the session? Again, feel free to use the raised hand icon if you want to ask online. So I'll pause here if there are any. Okay, I don't see it at this stage. I will say thank you for joining this session. I hope it's been informative and helpful and will serve you well in terms of future promotion for those of you who have access to this. If you do not have access to Health Business Elite and you're interested, please speak to your local EBSCO account team if you'd like to set up a trial and explore this further with your healthcare management team, as it were. Obviously, you can contact me directly at rcooks@ebsco.com if you have any specific questions about this database and the content coverage. There is a QR code there for the post-training feedback. If you've got time to scan that, I'll leave that up there. But otherwise, I'm happy to leave the session or close the session early. But again, I'll hang around for a couple more minutes if anyone has any questions, comments, or needs to review anything with me regarding this database. So thank you for your time today. I hope you found this session informative and look forward to seeing you online in the near future.